So I'm a board certified psychiatrist and have helped over 250 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, their treatment skills, and actually helping their patients get better so they can be better clinicians and make more money in the process. So in this video, I'm going to cover how you can have patients trust you. And I got the idea for this video because there's two patients I just saw yesterday. One of those patients, so she is a medical professional. And so she tells me that she has started taking Adderall, PRN, as needed, sometimes on the weekends to help her with energy and her job. And so she gets this off the street from somebody, like she's not prescribed this, but she told me that. And then I had another patient who tells me that they use marijuana and alcohol to help them fall asleep. And the patient is on controlled substances already. And then same with my first patient too. She was already on another controlled substance. And so a lot of providers, when they hear this kind of things, they have rigid rules about controlled substances where they're like, okay, so if the patient's on, for example, a benzo like Klonopin or a stimulant like Adderall, then no substance is allowed whatsoever. And then if they're using a substance, then I'm not going to prescribe the benzo to them. And patients, a lot of patients know that. Especially my patient who one of them was a healthcare provider. And then the other one, she was like, yeah, I take, she's already on Klonopin, but then, she talks about taking another stimulant. And so point being is that both of these patients told me that. So why did they tell me? It's because they trust me. So they trust that I have their best intentions at heart and that, I'm not going to judge them for it. I'm not going to shame them for it. And that, I'm going to work with them through whatever they're going through. So how to have patients trust you, right? The first step, as Ed mentioned, the number one thing is being non-judgmental. So this comes across in the demeanor that you have. So think about the patient's life, like in every day-to-day interactions. People are always judging them. Like at work, coworkers might be making fun of them, or family members might talk smack about them, kids, friends, peers, parents, whatever it might be. They have to present an image online as well, whatever it is. However, this is the space where they come for that non-judgmentalness, especially as psychiatric providers. And so for us, this is absolutely crucial that we do that. Of course, we might have internal feelings about a patient's behavior or things that they do. For example, you might be pro-abortion, and the patient might be very against it, or vice versa, or they might have a different political affiliation than you. Whatever it might be, the point is that you must come across as non-judgmental no matter what, because if you are not, the patient will feel rejected and they will always feel that there's some kind of barrier with you, which doesn't help your patient get the best level of care. And I remember I experienced this because, so when I was in my first year of residency, I started doing therapy because I wanted to see just how it felt like to be in that opposite position. So I did it for a year. And a couple months in, I remember I was seeing my therapist, and this was the re-election, the 2020 re-elections. And I remember saying that I was impressed by Donald Trump's business acumen and marketing skills because he had convinced and a half a country to vote for him despite not having ever been in political office. Like that was literally his pitch, that, hey, I have no experience, that's why you should vote for me. And it worked. So I was like, that's very clever marketing. I didn't say that I was like pro-Trump or against Trump. I just said, I made that comment. And she goes, huh, how could you like that man? And I remember hearing this, especially I was a psych resident at the time. And I was like, I can't believe she just said that. My therapist, my 60-year-old therapist who's been doing this for 20, 30 years. And so I just immediately shut down. And I was like, what the hell? Like, I can't say anything here. And so the next visit, she apologized and said that she shouldn't have said that, but the damage was done, right? Like I'm still talking about this 5 years later because I still remember that moment. So the key is that when you are in these interactions, you are doing surgery. Like when in surgery, you are very precise with your movements, right? So like what you can't mess up an artery cut or something because that could be life-threatening. Well, it's similar here. So the words we say, the body language, the attitude we have, all of that is verbal surgery. And the core of that is non-judgmental. We have to be non-judgmental no matter what the patient says or what the patient does. So that's the first thing. Then the next thing is using reflection. So reflect. This is one of my favorite things to teach and talk about, is because in conversation skills, people often talk without listening. So anytime somebody says something, half the time the other person is just listening or acting to listen. So that way they can say what they want to say, or like based off of what you said. Like they're already planning what they want to say, and like they're going to go right as soon as you end. You can tell a lot of times when someone is saying that. And what people never get in real life is someone actually listening to them and demonstrating that they're listening to them. And you have to demonstrate that you're listening to them using active listening. And it's not just like hearing, but it's active listening is nodding. It's giving cues that, okay, you're listening. Okay. And then it's also reflection statements. Because, hey, if I say, hey, I'm struggling with depression, anxiety, and bipolar, and so you could say, oh, wow, that sounds like a lot. Or, oh, so you had depression, anxiety, and bipolar. And so I'm like, yeah. And so see, now that confirms to me that the other person's listening. And so it makes me more invested in the conversation and want to keep on going. And like literally, if you ever listen to one of my visits, half the time I just spend reflecting. I swear to God, half the time is just I'm reflecting, because it leads to having patients trust you. That is the key there. So that's that. And then the next thing, of course, is authority. So ultimately, you need to be an authority here. The patient is not coming to you to be their friend. The patient is coming to you to be their psychiatric provider. And so what that means is that you need to present yourself with authority. You know what you're talking about. You dress the part. You act the part. You act professional. And the patient needs to feel that they are safe in your hands and they will be taken care of. When you go to a restaurant, you expect that the meal will be taken care of. It will be delicious. It will be served to you. You're not handling the dishes or like the cleanup or the grocery shopping. You expect that all of those things will be handled because you're going to the restaurant and you're using your money in exchange for that value that you get. Or when you go to the mechanic, you want the mechanic to look the part, right? Okay, you know that they've been in the trenches doing mechanic stuff. You want their like suit and stuff to be dirty, like, okay, like this guy knows what he's talking about. And when he speaks, he talks about these terms, and like you're like, okay, this person gets it, and he's able to diagnose your problem with your car, and then says, okay, it'll take 2 hours to fix, or this is the issue, and I need to order X part to fix it. You want that authority. You don't want the mechanic to just go, oh, that sucks, like, I'm sorry about your car and things, reflected back at you, but then they're like, they mess up fixing it. So authority, ultimately, right, that matters. And so tied to the authority is that whatever interventions, whatever treatments you have actually work. And then the last thing is care. So ultimately, you have to demonstrate that you actually care about the patient. You have to make the patient feel taken care of. It doesn't matter if you actually care or not. See, that's the thing, because sometimes people can care, but they don't know how to show it, right? You see this in relationships all the time, where the wife's like, oh, like, you don't care about me. And like the husband's like, I do care, honey. I brought the groceries home and I go to work for 10 hours to take care of the kids. But she doesn't feel taken care of because her emotional needs are not met. Or vice versa, right? The husband could be like, you don't care about me. And the wife's like, hey, you don't care about me because you don't want to be intimate with me. And she's like, well, I'm like pregnant and I'm doing this. And, I spent all day cleaning and you just sit there. Point being, it doesn't matter how you feel inside. It matters how the other person receives it, how they feel it. And so the patient needs to feel that you care about them, and then they will trust you. And how do they feel you care about them? By being the authority, by presenting them treatments that work well and helping them actually get better, reflecting, right? Being an active listener, and then being non-judgmental as well. So this is a guide on how to have patients trust you. And if you want to really master psychiatry, like you want to take this further, best way to do that is in our PMHNP and FNP coaching program, where we've had over 250 students go through so far and really start to master their psychiatric diagnosing skills, their treatment skills, their patient skills, their medication skills, learn integrative psychiatry, and all these will help them make more money in their lives and their professions. So if that helps you or if that interests you, consider joining our program, and I'll see you next.